Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental of Springfield in Springfield, Virginia. Today I wanted to talk to you about impacted teeth. So what is an impacted tooth? An impacted tooth is just a tooth that didn't come out all the way. Most people are familiar with this with wisdom teeth, but it happens sometimes to like the canine tooth or eye tooth get stuck up in there. Any tooth can become stuck in there. Also, sometimes there's something called supernumerary teeth, which is basically an extra tooth, and sometimes that'll get stuck in there. So if it's totally in the bone, it might be an inconvenience for like orthodontic purposes or straightening the teeth or cosmetics, but it's not going to hurt you. It's when the tooth is partially erupted and partially impacted that it causes a problem. And this is most common with wisdom teeth. So a lot of times we don't have enough space in our jaw for the wisdom teeth to come in straight. So they get half stuck in and half stuck out. And what that does on the top part of the tooth as it comes in, it's meant to resorb the bone. Well, if it's angled at another tooth, you can get resorption of the other tooth. So it can hurt the tooth in front of it. It can also create a spot that's hard to floss, that's easy to make a cavity. So it's when they're partially and partially out, you can't brush them, you can't floss it. It might be intentionally resorbing the other tooth to come in. That's when it's going to create problems. So in those cases, it needs to be either removed or exposed to bring it into place. So if it's a front tooth, we'll usually expose it and pull it in orthodontically. I do a lot of orthodontics in my office. I enjoy doing it. It's fun to do. And I do a lot of cases in conjunction with other orthodontics. So we have a laser in the office, very cuts very slowly, like almost one or two cell layers at a time. So there's not a lot of pain or discomfort or post-operative discomfort. It works great for bringing in an impacted tooth. So if you're doing your orthodontic case with me, I'll do it that way. If you're doing it with an orthodontist in the area and you want your child's tooth brought in a very atraumatic, non-bleeding way, give me a call and I can expose it with this laser. And the cool thing about the laser is that you can set it to cut only gum, only bone, or to a level that cuts teeth. So if I put it at a lower setting, it doesn't matter how much I hit the tooth with it, it's never going to cut the tooth. And that makes it super safe when bringing in a tooth because otherwise you're in there with a burr, which is quicker, and you're drilling the bone. But if you go too deep, you're going to nick the tooth. So the laser, not only is it less traumatic, but it's safer and it's less risk to the tooth. So if you're doing an orthodontic case in conjunction with an orthodontist and you don't want to go to an oral surgeon who's just going to zip in there with a burr and maybe damage the tooth, give us a call. I can put the bracket on for you so you don't have to go back to the orthodontist. There's a lot I can do in my office to help you with your case. But mostly when we're talking about impacted teeth, we're talking about wisdom teeth. I love doing surgery. I love taking out impacted teeth. I did it in the Navy. I've been doing it for decades. And we recently partnered with an anesthesiologist and I opened up a sedation clinic. So we can do full sedation and anesthesia at the office, same as you can get at the oral surgeon. Very safe, very effective. This was a need in the area that was unmet. A lot of oral surgeons do sedation, but for special needs kids, I have a hygienist who has a child with autism. I have other children with autism. I have other special needs patients. And for their safety, these patients really need to be put to sleep under general anesthesia. And that service was either exorbitantly expensive or very hard to find. And I took the opportunity to develop an anesthesia suite in my office and work with a great anesthesiologist. So we can put you to sleep, or if your child or yourself is unable to be safely put to sleep in the area and you need general anesthesia where the machine is breathing for you for your safety, we have that availability also. So I work with a board certified anesthesiologist. He comes in, he does the health assessment, he puts you to sleep. I do the dentistry, he wakes you up. So it's a very safe and convenient option for patients that before was very hard to find or was very expensive. And so looking forward to be able to do more of these cases in my office. And also I look forward to working with other dentists in the area. If you feel more comfortable with your dentist doing the case, but they just don't have a general anesthesia suite in their office, they're welcome to come in and do the case in my office as well. So I really do want to help people and help the community. And I think this is a good way to do it. But back to impacted teeth. If you want your wisdom teeth taken out with sedation or anesthesia, we have it available. I do like doing these cases. So when the tooth is half in, half out, that's when it's a problem. If it's totally in, it's not really a problem. We usually take wisdom teeth out before the age of 25 if we're going to do it, because up to the age 25, you get full bone healing. Past the age of 25, we can do something called a bone graft, which is like surgical packing you put in the area to help the bone promote and develop fully. So it's like a bone food, and bone minerals and collagen help stabilize the clot and helps keep the gum out of the hole and gives all the bone food for the bone cells. Within 6 months, they'll eat it up and turn it into your natural bone. But there's an extra cost for the graft. It's an expensive material. It's not that it takes long to place, we just pack it in there, but it's the material itself is expensive. So to save time and money, mostly money because the material is expensive, we usually do this before the age of 25. So in the 16 to 18 to 20, 22, 23 range, this is depending on the person, we'll typically evaluate the wisdom teeth and I'll have this discussion with the patient about whether or not I think it's safe to leave in or should come out. On rare occasions, impacted teeth do develop a cyst around them. As I was saying, the tooth develops in this little follicle or cyst, and it grows the tooth. The top of the tooth gets grown from the outside in, and then once the tooth erupts and that goes away, that's why teeth can't repair it themselves, and that's why you have to do all kind of crowns and fillings and stuff if they get a cavity. But this follicle, sometimes if it's kept down in the bone, on very rare occasion, it will grow and start to cause an issue. So that's rare, but that's one indication for taking out impacted teeth. And like I said, we usually do this at a younger age for healing reasons, but we can do it at any age and we can put you to sleep so we can do it comfortably in the office. Different types of impaction. So if it's tilted forward, we call it a mesial impaction. If it's fully sideways, we call it a horizontal impaction. If it's down or back or sideways, we might call it distal impaction. That doesn't really matter, but if you're Googling and you're seeing about different types of impactions, don't worry about it. It doesn't really matter. We're going to get it out for you safely and effectively no matter what. So give us a call at the office if you have concerns about impacted teeth, whether it's for orthodontic purposes or for wisdom teeth purposes. It's something I'm happy to do for you. Like I said, for the canines or orthodontic purposes, we have the laser. For wisdom teeth, we have the sedation. We can do them both together. Just know you'll get taken care of very well at my office with myself and my anesthesiologist. So if you have any questions about impacted teeth or need an impacted tooth removed or need a consult for an impacted tooth, please give us a call, 703-451-4500. Thanks.